All right. Well, hello again to everyone, and thank you for joining us, taking time out of your day for today's webinar, How to Keep Your Lab EKRA Compliant. We'll be presented today by Lighthouse Lab Services, along with Robinson and Cole, a national law firm with expertise in health law. My name is Alex Mitchell. I'm a communications manager for Lighthouse, and I'll be serving as your MC today. Just wanted to address a few housekeeping items out front. You can reduce your chance of buffering by closing any bandwidth-heavy apps that you may have running in the background. This webinar will be recorded, and we'll be sending it to all the attendees and registrants afterwards, so no need to worry about that. If you have questions throughout the webinar, feel free to use the Q&A chat box. Those will be visible to our presenters, and they will be answering them as they have time, and once answered, those will become public for everyone to view. And keep in mind that we'll also be running polls during the webinar, and we highly encourage you to participate in those to help inform future topics that we might cover and just provide more information about our audience. So we really appreciate your participation in those. And now I just want to turn it over to Danielle H. Tangor, who will be our first speaker today. She's a partner with Robinson and Cole. Danielle represents and advises a broad range of healthcare providers, including clinical labs, long-term care facilities, behavioral health providers, and she is also a member of the Health Law Group. So Danielle, when you're ready, you can take it away.
Thank you so much. Hello, everyone. Good afternoon. It's great to be talking to you today. We're going to try to address various issues with regard to EKRA that are important for labs to consider, and feel free to ask questions. Anna and I will be addressing both. As a first disclaimer, as a lawyer, I'm providing general information, not providing legal advice, and no attorney-client relationship has been created. So I wanted to start with the background on EKRA. This law has been around for almost 3 years. It was signed into law on October 24th, 2018. It was part of the Substance Use Disorder Prevention Act that has a long name, also known as the Support Act, which was really targeted for the opioid toxicology space. And at the very end, clinical laboratories were added. And so this has created a lot of interesting questions for laboratories over the years as we've grappled with what this means. But we'll get to that, and we've seen a lot more indictments, so we are getting more info as to what's the government's position on EKRA. So the important part to first start out is comparing EKRA versus the Anti-Kickback Statute. It is modeled after the Anti-Kickback Statute and actually a Florida patient brokering statute. And as you can see, it's similar from the beginning. It's a criminal statute. Whoever knowingly and willfully solicits or receives any remuneration, directly or indirectly, overtly or covertly, in cash or in kind. And that's where it then changes. So under the first provision, EKRA is arguably a little bit broader because it's in return for referring a patient to a laboratory. And I'm just going to focus on the laboratory piece here, not the substance abuse piece, but a lot of this goes both ways. This language is really important, and we'll get into it, particularly when we talk about sales and marketing. Under the Anti-Kickback Statute, you have two provisions, either in return for referring an individual or arranging for that furnishing of an item or service, or there's the second provision about arranging for recommending of ordering or purchasing for which payment can be made. It's usually the second provision of the Anti-Kickback Statute that is used in indictments in cases on the sales and marketing front, and the language is obviously very different for EKRA. There's also the second provision of the statute, which as you can see, is also very similar. It starts out the same, but the difference is the second provision of EKRA says to induce a referral of an individual to a lab or in exchange for an individual using the services of a lab. So this has been pretty broad language. There are no regulations yet, so we haven't gotten too much guidance, but we have started to see indictments that are providing some explanation as to what all of this means, which I will discuss in a little bit. One of the main differences of the Anti-Kickback Statute and EKRA is that the Anti-Kickback Statute states actual knowledge or specific intent is not required. That was developed in case law for a long time and then was actually included in the statute. EKRA is silent, so it's still up in the air as to whether you need actual knowledge to be knowingly and willful, or if it's going to be mirroring the Anti-Kickback Statute of not being required. One of the big things is that EKRA applies really broadly. The term laboratory has the meaning under CLIA, so it is not limited to toxicology labs that, you would think would be the target under this Support Act because it was targeted to address the opioid epidemic and concerns as to the substance abuse space. As we've seen, there was some thought that laboratories would be limited based on the legislative history to toxicology, but many of the indictments coming down have been in COVID-19 and RPP testing, as well as in the PGX, CGX space. So it's really important to remember that even if you're not a toxicology lab, you do need to be concerned about EKRA because the statute, by the definition, includes all clinical laboratories. So one of the main issues and questions that we discuss when we just talk about EKRA is commission-based compensation. Going back to the Anti-Kickback Statute, historically labs have been able to pay their sales and marketing staff percentage-based compensation if they were employees, not if they were independent contractors, but if they were a bona fide employee, you had a lot of latitude as to how you could pay your sales and marketing staff. There may be, changes based on state law, but historically that was the industry standard. EKRA came and turned that on its head because not only does it prohibit an employee, but it also prohibits independent contractors. And it specifically lays out three criteria that you cannot pay your employees or independent contractors, which is particularly important in the sales and marketing space. You can't pay based on the number of individuals referred to the lab, the number of tests or procedures performed, or probably the most important, the amount billed to a healthcare benefit program by a lab. And healthcare benefit program is not only federal payors, but it also includes commercial payers. So this is the other major difference between EKRA and the Anti-Kickback Statute is that it's not just federal payers anymore. It's also your commercial payers. So far, most of the public indictments have all been federal dollars and federal payments, but I can imagine that commercial payers are going to use this in their audits as yet another way to go after and negotiate repayments and recoveries from labs based on this particular space. And you probably just got a poll, so if you wouldn't mind filling that out, that'd be great. The other major difference is personal service and management contracts. So this exception under the Anti-Kickback Statute was how you could have independent contractors do various work for the laboratory. It does have a variety of requirements, including that you have to have a flat fee at fair market value. The interesting part is that under the recent amendments, to start an anti-kickback, the anti-kickback did.
Just one moment, folks. It looks like Danielle's connection might have cut out. We'll allow just a minute here for her to try to dial back in. Looks like she's just getting reconnected, so just bear with us for a few more seconds here.
Alex, can you hear me?
Yep, we can hear you just fine. Whenever you're ready, you can take back over.
Sorry about that. So, as I was saying, the personal service and management contracts for under the Anti-Kickback Statute have a variety of requirements, but have recently changed under the most recent promulgation of the regulations, but EKRA did not follow suit. So the EKRA statute says, as it relates to independent contractors and using the personal service and management contract safe harbor, that the payment has to meet the requirements of the Anti-Kickback Statute safe harbor as an effect of the date of the enactment of the section, i.e., what the safe harbor was for the Anti-Kickback Statute in October of 2018. So that's very different than what is currently being done with the changes to the personal service and management contracts under the Anti-Kickback Statute. So that just means that you, as a lab, have to make sure that you're complying with both, which means you might not be able to take advantage of the newer regulations and some of the opportunities they provided for different payment mechanisms under the new safe harbor under the Anti-Kickback Statute, because if you have to comply with EKRA, you have to do it with the historical view. I also want to raise, and we haven't historically talked about this too much, is the co-insurance discount waiver and exception. I wanted to raise this because it tracks the Anti-Kickback safe harbor, and it requires you to be able to provide a discount of co-insurance or co-payment if it's not routinely provided and it's provided in good faith. And this is really important because as a laboratory, you may be offering a variety of discounts or other lab pricing models that previously you had to be concerned about if you were billing federal payers, but now you also have to be concerned about with commercial payers. There may have already been state laws that mirrored the Anti-Kickback Statute that made you have to consider commercial payers and how you were pricing and everything. But now EKRA specifically addresses this issue. So it's important that you look at your pricing model and how you are offering discounts, if you are at all, to ensure that you're not in violation of EKRA or the Anti-Kickback Statute. I think this is also going to be a really hot area for commercial payers and how they look at payment structures and, again, audit laboratories. So I want to spend some time talking about indictments and some of the recent cases and things of that nature, because I think that provides us the most guidance since we just have the statute with no regulations at this point. The first case I want to talk about is Mark Shenna. This came out last year, but interestingly, they filed a superseding indictment in May of this year, which specifically added a violation of EKRA. So Shenna is the president of Ariat Corporation, which is in the medical technology space. There's a variety of claims and under the indictment about his statements to the public and whether they were fraudulent or not. as he claimed that Ariat could test for both allergens and COVID-19 through dried blood samples. And he was also bundling COVID with allergy testing, which has been a topic of concern over the last year and a half with COVID, and the CMS and the OIG coming out saying that that can be a potential for fraud and abuse. So there's allegations about fraudulent marketing material and concerns about the actual medical necessity of these test results. But the more interesting thing for this presentation is that they added a cause of action for violation of EKRA under Section 220A2A, which if we go back to what that meant, that is knowingly and willfully paying or offering any remuneration, directly or indirectly, in cash or kind, to induce a referral of an individual to a laboratory. So this is important because it goes directly to referring individuals to laboratories and references payments being made to a marketer. So this is one of the first cases that we see that really addresses sales and marketing and how it specifically impacts your sales and marketing arrangements under EKRA. The next case is U.S. versus Riyadh Salah al-Din, and I'm probably mispronouncing that, but this here there's alleged that there were multiple co-conspirators and defendants that knowingly and willfully conspired, not only amongst the three of them, but with other co-conspirators to violate both the Anti-Kickback Statute and EKRA. This is in the CGX-PGX space. Approximately $522 million was submitted to federal payers for genetic testing, and approximately $84 million was paid out to the laboratories. Here, this goes to how you should not structure some of your sales and marketing agreements. So here the defendants are alleged to have paid what would seemingly be a compliant arrangement because it is a flat fee on a biweekly basis. So you are not violating one of those provisions we talked about as a percentage base, but what the government is alleging is that this is just a sham contract and that the sum of almost $109,000 on a biweekly basis really represented a per sample fee based on projections for genetic testing samples. This is important because as you look to your contracts and you need to have generally a flat fee, but we'll get to part of that, it still needs to be fair market value. It can't be tied back to volume or value per samples or percentage amount. And that's the hard part, but that's also the really important part when we're talking about structuring compliant relationships. They're also alleging that other payments reflect volume-based payments and other kickbacks that were paid to the marketing company. There's several cases like this where there are flat fees, but are so out of fair market value that the government is alleging that they are sham contracts that are really based on per samples. Even some of the indictments, not this one in particular, but others have.
Looks like we might have lost Danielle again there. I think she's struggling with a bad phone connection, so just bear with us for a minute, and I'm sure she'll be back.
Hi, it's Danielle.
Hey, Danielle. We can hear you.
Sorry, everyone. Apologies for my technology difficulties today. So as I was saying, there have been several cases where even there's details about text messages or Excel sheets or emails where the government was able to trace back per volume samples to the seemingly flat fee basis. So it's really important that the contracts are legitimate and actually reflect a fair market value at a flat fee and are not some type of workaround or back-ending into covering up what really is a volume-based test. Another case is U.S. versus Tariq Greece. This scheme did not involve a laboratory, but a clinical treatment facility. I wanted to raise it because it's yet another case that speaks to kind of the marketing service contracts. This goes to what I was just talking about. The monthly payments here are a lot less than what we just saw with the other case, but it's still a monthly payment of $30,000. The government's alleging that that's not fair market value and was really based on a per volume calculation, and really went into depth of how that changed with statements that, oh, we have to change our sales and marketing agreements based on EKRA, and then they created a monthly payment of $30,000, but the government's alleging it's just a sham contract. So it's important to really think through these things when you're making the change and looking to make compliant contracts. Another notable case is Jonathan versus Markovich. This is 10 defendants in Southern District of Florida. There's a variety of things going on in this case in the tax space, with payments directly to patients from the substance abuse facilities and things of that nature, money laundering, but it also involves payment by labs to various individuals for referrals for urine drug testing. And the concern here was that the urine drug testing was not always medically necessary, was of a high quantity, oftentimes for the highest code, and there are allegations that this is in violation of EKRA. One of the things I did not include here on the slide deck was a case that got announced this week, actually, the United States of America versus Yitzhak Kurtzer and Robin Kurtzer. It specifically alleges violations of the Anti-Kickback Statute, but also EKRA. Under both provisions of EKRA, Section 220A1 and Section 2, and they specifically label it illegal remunerations for referrals to laboratories. The issue in this case is that Laboratory 1 and Laboratory 2 collected genetic test swabs and submitted them for reimbursement to Medicare. Oftentimes, those laboratories did not perform the actual genetic testing, but outsourced it to a third lab. And it specifically notes that the individual marketer who was getting swabs from both nursing homes and physician offices for the genetic testing, his compensation was paid from each laboratory in part on the volume of genetic tests that the individual generated. So we're seeing very directly referrals to the laboratory based on the marketing efforts of the sales and marketing individual, and that he was paid based in part on a per sample or percentage fee. And there are allegations, 3 different allegations that he caused the referring a patient to a laboratory for tests covered by a healthcare benefit program. It's going to be really interesting to see where this goes. That case also has causes of action that include the Travel Act as well as the Anti-Kickback Statute in addition to EKRA. So those are some of the most notable cases. There's been some others. It's been both in the PGX tox and COVID space. There's been one settlement, which was pretty early on, but a clear violation of the Anti-Kickback Statute. So we're starting to see an uptick in these. There's more and more coming out every week. So EKRA is definitely being used by the OIG as a tool to go after what they perceive to be bad actors and arrangements that are not compliant. So we're going to start talking a little bit about some takeaways. You know, it's really important for laboratories to do two things. First, look at their sales and marketing contracts. You know, if you still have independent contractors, definitely get away from that. Make them employees, but then you still have to be concerned about complying with EKRA. So you need to create alternatives to commission-based payments. You can't simply convert expected volume to flat fee. We saw this as being really problematic in all of the cases that we just talked about. You need to establish fair market value. You can have, you know, certain type of incentive type compensation. That's going to be very lab specific, and you really need to think about that and how to make that compliant and not run afoul of those three criteria that we previously talked about. The other thing is that all labs should look at their pricing structures and make sure that they're in compliance with the discount safe harbor, both under EKRA as it stood with following the old Anti-Kickback Statute safe harbor. Those are just two of the main areas that you really need to focus on. It has, you know, impacts on potentially management service company contracts as that's going on with your lab as well. But I'm going to turn it over to Ann now as kind of the key takeaways, and I'm sure we'll be happy to answer any questions.
Yeah, well, thank you, Danielle. Yeah, we're going to kick it over to Ann from Lighthouse. Ann is Lighthouse's Vice President of RCM Consulting. She heads up the company's day-to-day operations in that division. So, Ann, you can go ahead and get started. And right before you do, I just wanted to let everyone know you're going to see a pop-up offer come up on the bottom corner of your screen while Ann's talking. If you're interested at all in having someone contact you regarding a follow-up conversation on any of the items discussed today or just your lab's overall compliance plan, please fill out that form and someone will be in touch with you. Ann, you can take it away.
Great, thanks, Alex, and thank you so much, Danielle. I found that this webinar has been very informative for me and hopefully for our attendees as well. For myself, we work with labs all over the country, and this past year with COVID, I have found that either myself, we've kind of forgotten about EKRA or pushed this on the back burner. And now it's coming to light again. You can see with some of the legal implications that Danielle pointed out previously. This is something that we need to continue to be advised on and work towards being compliant. In doing my research for the webinar, one of the things I found, the National Law Review just published an article on July 24th last week, 12 compliance priorities for clinical labs that bill Medicare, Medicaid, or TRICARE. And they, in this article, address the OIG model compliance plan for clinical laboratories, which is my backbone of just helping my groups understand how to set up a compliance plan. And it is simply just a recommendation, but I wanted to point out in the webinar today that in that recommendation, they notably speak to, out of those 12 priorities, 3 of them I thought was pertinent to today's conversation with EKRA, addressing standards of conduct and employee performance, employee education and training, marketing compliance, and that should be addressed within your compliance plan, along with other things. But just talking about, and I put on my slide, again, making sure that you're aware of EKRA and your implications and its implications for your business. Making sure that you're not just ignoring it, saying, I don't understand it, it's not relevant to me, you should be starting with something. And typically I advise to start with your compliance plan. So again, making sure that you have a compliance plan. If you don't, certainly I know Danielle and myself can advise on a compliance plan and work with you to set something up. And you customize that based on your lab's own characteristics and recommendations. It's a customized compliance plan, and it would hopefully, again, addressing EKRA within your compliance plan would reflect, the good faith efforts that you're complying to the best of your abilities. So that's what, as far as documenting within your best understanding, making sure that you've again shown that you've done your due diligence to understand. I noted too, to start somewhere. So again, do you have a compliance plan? Have you internally discussed EKRA and how it impacts your laboratory? Have you obtained outside counsel? Again, making sure that you have a legal advice as you work through your compliance plan. And are you documenting that within your compliance plan? And finally, do you have someone that's managing and auditing your adherence to your compliance plan? I think is very important. So again, I think just recommending, as far as practicality is recommending, really look at those compliance plans and start making sure that they're up to date and that they are complying with EKRA guidance. All right, so we did have a couple of questions, and I think that those two questions are very specific. I don't know, Danielle, if you want to address a couple of those, or if you want maybe those individuals to reach out to you directly.
Sure, I'm happy to do both. I know the question that there's for EKRA for laboratories. So physician-owned labs is really generally a state function, but physician-owned labs would be, still under the large definition that is referenced in EKRA. And hospital laboratories, I haven't seen a huge crossover yet as that, but they should also be cognizant of EKRA and how it impacts them, particularly in their reference arrangements. So there is, both for hospital and POL concerns about EKRA that should be considered and addressed in your compliance plan. And just to Ann's point about the compliance plan, that's a great advice that Ann gave. You really need to look at your compliance plan, make sure it's active. You don't want something that's just sitting on the shelf collecting dust. It really needs to be an interactive compliance plan that, is growing and adjusting to your practices and procedures. That is something that gets looked at in an investigation if you were under investigation. So it's really important that you have an interactive, applicable compliance plan. And I see another question about billing through insurance or Medicare. EKRA does not apply to cash only, but if you have a hybrid lab where you're billing commercial insurers or federal payers, and also doing cash pay, then EKRA would apply. But if you are a true cash only lab, then EKRA doesn't apply to you because it's not a healthcare benefit program.
Thank you for addressing those, Danielle. Anne, do you see any others, or Danielle, that we would feel comfortable tackling right now, or would the rest be best addressed through follow-ups?
Again, there's a couple in the Q&A that I think would be best addressed in the follow-ups, Danielle, unless you have additional comments on those. Again, I think that there's more to some of these questions that should be addressed, one-on-one, but certainly if you disagree, if you want to answer any of those.
Sure. So I'll just first address the cash pay piece before I get to some of those other questions. If you are a solely cash pay lab where you are only taking payment and not billing federal or commercial payer, so you're not billing, Medicare, Medicaid, TRICARE, or any of the commercial insurers, Blue, Aetna, Cigna, whatever commercial payer you may be. If you're not billing any of them, then it is not a healthcare benefit program. So if you are just accepting cash directly from the patient walks up to the lab and says, hey, I need this test, and you get payment directly from them, EKRA's not going to apply. The other questions about examples of compliant compensation plans for labs, I tried to give you a lot of not to do's. Developing a compliant sales and marketing plan or pricing structure is really lab specific. There are ways to do incentive compensation that can be tied to your compliance plan, but you can't have the historical percentage based compensation of, you'll get 10% of what you bring in. That's no longer feasible under EKRA. So I know that it's difficult as sales and marketing reps really want to have that carrot and be rewarded for their growth. Labs, particularly smaller labs, are looking, to find that balance of paying a salary, but also encouraging their reps. But you have to look at how you do things, look at your lab structure. There is potential for bonuses based on the overall profits of the lab or other incentive structures that can really be tied to your compliance plan. One of the historical, concerns that generated the safe harbor under the Anti-Kickback Statute being bona fide employees is that there was a lot of concern that independent contractors were at higher risk for fraud and abuse because you didn't have as much control, and particularly concerned about them going out and generating not medically necessary testing and all of these things that we historically have heard about being concerns of fraud and abuse. So one of the things that you really have to think about is structuring plans and incentives that work toward achieving your compliance goals, whether that's, having appropriate requisitions completely filled out, getting medical records, things of that nature. But it's all really going to be lab specific. So I can't give you an example of a compliant compensation plan because you really need to look at your own lab and talk to an attorney as to what makes sense for your lab.
Yeah. Well, thank you, Danielle. I think that really addresses it, how lab specific a lot of this information is, and I appreciate you diving in to answer those questions. And unless you had anything else, I think we're going to go ahead and wrap up for today.
No, I have nothing else.
Okay, awesome. Well, I just wanted to say thank you again to both Ann and Danielle. You were fantastic. Lots of great information here today. And if you want to follow up on any of that, please don't hesitate to reach out to us or use the contact form that was presented. Just want to mention real quick that next month we'll be doing a webinar on preparing for 2022 PAMA data reporting. Hard to believe it's almost here already, but it is. That'll be on August 25th at noon, and you can register using that link or heading over to our webinar registration page. All attendees from today will also receive email reminders about that webinar. So thanks again to everyone, and enjoy the rest of your day.